Hello, friends. I hope all of you are well and enjoying the life. I am Dr. Mohammed Shafi. I am working as professor in the Department of Community Medicine at JIIU's Indian Institute of Medical Science and Research, Badnapur, Jalna. Every year, we observe World Cancer Day on 4th February. On this day, more stress is given on the cancer, its prevention and control. So, this is my small effort to prepare the video on cancers. So in this video, we are going to see what are the common cancers, what are their common signs, and the screening test applied to detect these cancers. Now coming to the common cancers, they are classified into two categories. One is among male and second is among females. So these are the 5 common cancers among male in India are lip and oral cavity, lung, stomach, colorectal and esophagus cancer, and prostate. Whereas in female, 5 most common cancers are breast, cervix, ovary, lip and oral cavity, and colorectal cancers. So, depending on the organ involved, a patient may have some sign and symptoms so that we can detect the cancer in early stages. It is very important to detect the cancer in early stage of 1 or 2 because if we detect them in stage 1 and 2, they are mostly curable. But if we detect in stage 3 and stage 4, the prognosis is very bad and patient is likely to live for a short period of time. So the usual sign and symptoms which are found in an individual are: first is unusual bleeding or discharge from any opening of the body, like mouth or anus, urethra, or any part of the body if there is a bleeding or discharge. Then change in bowel and bladder habits. Suppose a person was having regular bladder and bowel habits. So there is a sudden change in bladder and bowel habits. A sore that does not heal, like there is an ulcer over the body and it is not healing even after taking treatment for long time. Nagging cough and hoarseness, so there will be a dry cough and the person is likely to have the thickened voice. Then there is a loss of weight in a short period of time, more than 10%, without any visible cause. If a person is having a mole or wart since long time and there is a sudden obvious change in the mole or wart. If a person is having indigestion or difficulty in swallowing, or there can be thickening or lump in the body. So these are the common early signs of the cancers. So if you find anybody having these signs, he should be subjected for screening of the cancer depending on the organ involved. So screening is the very important tool to detect the cancer in early stage. And definitely it has a very good benefit of saving the life from cancers. So screening is usually done in a person who looks like healthy, but the disease process has started in the body. So these screening tests will try to detect the changes which are taking place in the body. So these are the some common cancer types along with their routine screening test. Like in breast, we do mammography. For cervical cancer, we do PAP and HPV test. For colorectal cancer, usually we do a stool test for occult blood and colonoscopy. Whereas for the lung, CT scan is the best screening test. For prostate, we have digital rectal examination and prostate specific antigen test of the blood. Here it is shown in detail about the various screening tools for various types of cancers. So you can see here in the breast self-examination is very important. So female herself should examine her breast at the age of 40 or 50 years at regular intervals. Along with that, we can go for mammogram or ultrasonographic examination. Cervical cancer, we have PAP test and HPV test. For prostate, I told you, lung is the CT scan, and colorectal cancer, we have the blood test for occult blood and colonoscopy, which should be started after the age of 50 years. This picture shows how the mammography is done for the breast cancer. Then there are some cancers which are not detected in their primary original origin organ, but the cancer spreads from those organs to other organs. So most commonly, we find the spread or metastasis in the brain. So the person will have some signs and symptoms related to the brain, like headaches, seizures, or vertigo. Whereas in respiratory spread, there will be a cough, there will be blood in the sputum or cough, dyspnea, and breathlessness. Then lymph nodes will be enlarged, which will be palpable. In case of liver spread, there will be hepatomegaly or enlargement of the liver, and the patient will have the jaundice. If the cancer spreads to the bone, then patient is likely to have pain, bony pain, fractures, spinal cord compression. So these are the some places where the cancer can spread. Now coming to the brain cancer or brain tumor, if it is present in the brain, then a patient is likely to show some signs and symptoms like headache, nausea, vomiting, issues with the vision, hearing loss, sleep wake disturbances, confusion, and issues with self identity, and sometimes seizures or convulsions. So, like this, the patient may present with different signs and symptoms, and we have to apply a suitable screening test so that we detect the cancer in early stage, and by that we can prevent and control the cancer. So this is all about the common cancers, their signs, and the screening test. Thank you.